I want to ask you something, and I want you to really think about your answer before we go any further. How many supplements do you take every day? A multivitamin, maybe? Some vitamin D, possibly fish oil. Perhaps calcium or B12 or magnesium or a joint support formula. Maybe something for your heart or your memory or your immune system. If you're like many older adults I've worked with, you've accumulated these supplements gradually over the years, adding one here, one there, each time with the best intentions, each time believing you were doing something good for your body. And most of the time, that intention is genuinely well placed. Many supplements, taken appropriately in the right doses for the right reasons, offer real benefits. But here's what I need you to hear today. Every single supplement you swallow, every vitamin, every mineral, every herbal capsule, every formula with a health claim on the label, has to be processed by the same organ, your liver.
And your liver, after 60, is doing that job with less efficiency than it had 20 years ago. It's quieter about it. It doesn't complain loudly. It just keeps working, day after day, processing everything you give it, until one day, the signals start to appear. And those signals are what most people miss, because they don't look like liver signals. They look like fatigue. They look like digestive discomfort. They look like the kind of things we've all been told to expect as we get older. Today, I'm going to walk you through 3 specific warning signs that your liver may be under more stress than it should be. Warning signs that can appear gradually, quietly, and easily get dismissed. One of them, as I'll explain, shows up during something most people do every single day, and it's almost always written off as something else entirely. Stay with me, because understanding this could genuinely change how you think about the supplement shelf in your medicine cabinet. Over the years of working with older patients, one of the patterns I've seen repeatedly is this. Somebody comes in feeling off, tired in a way they can't explain, maybe some nausea here and there, appetite not quite what it used to be. And when we start working through possibilities together, we eventually get to the conversation about supplements. And it's at that point, when we actually lay out everything they're taking, all at once, on paper, that both of us often realize for the first time just how much the liver has been quietly managing every single day. A multivitamin, an additional vitamin D tablet, on top of the D already in the multivitamin, a separate B complex, iron, calcium, a fish oil, something marketed for energy, something for joints with herbal ingredients they haven't looked up, something a friend recommended for sleep. Each one, individually, was chosen thoughtfully, but no one, not the doctor, not the patient, had ever looked at all of them together. That is not a failure of character. That is a failure of the system, and it's more common than most people realize. So let me start with what the liver actually does, because I think once you understand this, everything else will make immediate sense. Your liver is the largest internal organ in your body, and it is working every single moment of your life. Think of it as the master processing facility for everything that enters your bloodstream, whether that's food, medication, or supplements. Every substance absorbed through your digestive system travels first to the liver before it reaches the rest of your body. The liver decides what to activate, what to neutralize, what to convert into something usable, and what to package for elimination. It produces bile to help digest fats. It regulates blood sugar by storing and releasing glucose. It processes hormones, filters toxins, and manufactures proteins essential for blood clotting and immune function. It is not a passive organ. It is one of the busiest, most essential chemical processing facilities in the human body, running every minute of every day without any conscious effort on your part. After 60, several things change about how the liver performs this work. Blood flow to the liver decreases naturally with age. The liver's overall mass gradually reduces. The enzymes responsible for metabolizing drugs and supplements become less active. What this means practically is that substances your liver once cleared quickly and efficiently now spend more time in your system. They accumulate at slightly higher levels. They interact with other substances in ways they might not have when you were younger. And the margin between an appropriate dose and an excessive one becomes narrower than the label on the bottle was designed to account for. Most supplement dosages are not specifically calibrated for older adults. They are formulated for general adults and tested, if tested at all, in younger populations. The dose that poses no issue for a 40-year-old with a fully efficient liver may be meaningfully more taxing for a 70-year-old whose liver is processing everything a little more slowly. Now, let's talk about what can actually create liver stress from common supplements, because I want this to be practical and specific, not vague. Vitamin A is one of the most important to understand. It's present in most multivitamins in a form called retinol, or in a precursor form called beta-carotene. Vitamin A is genuinely essential. It supports vision, immune function, and cell development. But it is also a fat-soluble vitamin, which means it doesn't leave the body the way water-soluble vitamins do. It accumulates in the liver over time. And at high doses, levels that are more easily reached than most people realize when someone is taking a multivitamin that already contains vitamin A and separately consuming foods or other supplements that contribute additional amounts, vitamin A can become directly toxic to liver cells. This isn't something that happens from a single dose. It's something that can develop slowly over months or years of regular excess intake. And because the accumulation is gradual and the early symptoms are nonspecific, it often goes unrecognized for a long time. Niacin is another. Niacin, also called vitamin B3, is sold both as part of multivitamins and in standalone high-dose forms, often marketed for cholesterol support. At low dietary doses, it's safe and important. But at high therapeutic doses, the kind found in some cholesterol-targeting supplements, niacin is one of the most well-documented supplement-related causes of liver stress. Even at somewhat lower doses, certain forms of niacin, particularly sustained-release formulations, have been associated with liver enzyme elevation in some people. Iron is a third. Iron is essential, and supplementation is sometimes genuinely necessary, particularly in people who have confirmed iron deficiency anemia. But iron supplementation in people who don't need it, particularly older adults, in whom iron deficiency anemia is less common than it is in younger women, can lead to iron accumulation that the liver must manage. The liver stores excess iron, and over time, too much stored iron can contribute to oxidative stress and liver cell damage. And then there's the category I want to spend a moment on, because it's the one that genuinely catches people off guard most consistently: herbal ingredients. Many supplements marketed for joints, sleep, energy, memory, and immune support contain herbal extracts. And the word herbal, in most people's minds, is synonymous with gentle and natural, but the liver doesn't respond to something more gently because it came from a plant. Many herbal compounds are processed through the same liver enzyme pathways as pharmaceutical drugs, and some of them are documented to cause liver stress at certain doses or in certain individuals. Herbs like kava, comfrey, pennyroyal, and certain formulations containing pyrrolizidine alkaloids have well-documented liver toxicity. But even more commonly used herbs, high-dose green tea extract, for example, which appears in many weight management and energy supplements, have been associated with liver enzyme elevation in some people when consumed in concentrated supplement form. This is not the same as drinking green tea, which poses no concern. It's the concentrated extract form that occasionally causes problems. The important takeaway here is not to avoid all herbal supplements permanently. It's to know what's in what you're taking, and to make sure someone with clinical knowledge, your doctor or your pharmacist, has looked at your full supplement list with aware, informed eyes. Which brings me to the 3 warning signs. The first warning sign is fatigue, that is different in character from ordinary tiredness. I know, fatigue is one of those symptoms that shows up in virtually every health conversation. But liver-related fatigue has a particular quality that distinguishes it, at least for many people. It tends to be present in the morning, not just at the end of the day. It tends to be unresponsive to sleep. You can rest all weekend and still feel this heaviness. And it's often accompanied by a general sense of something being off, a vague discomfort in the upper right area of the abdomen, sometimes described as a feeling of fullness or pressure beneath the right rib cage, where the liver sits. This is the sign that most seniors write off most readily because fatigue is so easily attributed to age, to poor sleep, to stress, to any number of other things. And sometimes it is those other things. But if your fatigue has been persistent, unexplained by obvious causes, and accompanied by any of the other signs I'm about to describe, your liver deserves to be part of that diagnostic conversation. The second warning sign involves digestion, specifically nausea, a persistent sense of fullness or discomfort after eating, or a loss of appetite that has developed gradually over weeks or months. When the liver is under stress, it can affect the production and composition of bile, which your digestive system depends on to process fats. The result can be digestive discomfort, particularly after fatty meals, that feels like it's coming from your stomach, but is actually connected to liver function. Some people describe a sense of queasiness that they never associate with a supplement. Some notice that they've simply stopped wanting to eat the way they used to. Not dramatically, not in a way that triggers immediate alarm, but enough that someone who knew them before might notice. Loss of appetite in older adults is one of the most consistently under-investigated symptoms in medicine, in my view. It gets attributed to medication side effects or just eating less as you age. And while those explanations are sometimes accurate, liver function genuinely deserves to be on the list of things evaluated when appetite has changed significantly. The third warning sign is the one I mentioned at the very beginning, the one that appears during something ordinary that almost no one connects to their liver, and that I want you to start paying specific attention to starting today. The color of your urine. I know that's not a glamorous topic, but bear with me because this one is genuinely important. Healthy, well-hydrated urine is a pale yellow, the color of light lemonade. When the liver is under stress and struggling to process bilirubin, a waste product from the normal breakdown of red blood cells, bilirubin can begin to spill into the bloodstream and from there into the urine. The result is urine that turns darker, amber, tea-colored, sometimes described as the color of apple juice. This change can happen gradually and be easy to dismiss, especially if you assume you're just not drinking enough water. And sometimes that's true. Dehydration darkens urine as well, and staying hydrated is always worth addressing first. But if your urine has been consistently darker than it should be despite drinking adequate water, and that change has developed alongside any fatigue or digestive discomfort, please bring it to your doctor's attention and mention your supplement regimen specifically. In more significant liver stress, bilirubin can also cause a yellowing of the whites of the eyes, called jaundice, and sometimes a yellowing of the skin. These are signs that warrant prompt medical evaluation, not a wait-and-see approach. I want to be clear that I'm not saying this is likely from a standard multivitamin in most people, but in someone who is supplement stacking, taking high doses, or has an individual liver sensitivity, it can and does occur. There is also a skin symptom worth mentioning, persistent itching, particularly without an obvious external cause like dryness or a rash. When bilirubin builds up in the bloodstream, it can deposit in skin tissue and cause an irritating itch that's difficult to explain and impossible to relieve with lotion. It's one of those symptoms that gets attributed to everything except what it might actually be. Now, I want to make sure I've given you the other side of this clearly, because I don't want you to walk away from this video throwing everything in your supplement cabinet into the trash. Supplements can be genuinely beneficial. Vitamin D deficiency is extremely common in older adults and has real consequences for bone health, immune function, and mood. Magnesium supports sleep, muscle function, and blood pressure in ways that are well documented. Omega-3 fatty acids from fish oil have meaningful evidence for cardiovascular and anti-inflammatory benefits. A well-chosen, appropriately dosed multivitamin can fill dietary gaps that become more common with age. The issue is not supplements as a category. The issue is the uncurated accumulation of supplements over time, without anyone reviewing the full picture, without attention to dose, without awareness of what the liver is processing in total. The most practical thing I can suggest, and this is something I encourage every patient I have to do, regardless of age, is to bring every supplement you take to your next doctor or pharmacy visit. Not just the prescription medications, everything. The vitamins, the herbals, the protein powders, the teas, the collagen, all of it. Lay it out ask for a review. Ask specifically about your liver enzyme levels if you haven't had them checked recently. It's a simple blood test, part of a basic metabolic panel, and it tells your doctor a great deal about how your liver is handling its current workload. A pharmacist, as I mentioned in our melatonin video, is also an extraordinary and underused resource for exactly this kind of review. They're trained specifically in drug and supplement interactions, they're accessible without an appointment at most pharmacies, and they can flag combinations that your doctor may not have had time to address. I'd love to hear from you in the comments. Do you take a daily multivitamin? How many total supplements are you taking right now? Do you even know the exact number offhand? Has anything I've described today made you think of a symptom you've been experiencing and not quite understanding? And tell me where you're watching from. This community is genuinely one of the things that makes doing these videos meaningful to me, and I love knowing who's here. Here's what I want you to leave with today. Taking care of your health is a form of respect for your own life, and buying supplements is, for most people, a genuine act of care, an attempt to support a body that you want to keep well for as many years as possible. That intention deserves to be honored with good information. Good information means knowing that the liver has limits, that natural doesn't automatically mean safe at any dose, that the cumulative load of everything you take matters as much as any single ingredient, and that a periodic review of what you're taking with a qualified set of eyes is not an admission that you've done something wrong. It's a smart, proactive act of self-care. Your liver has been processing everything you've eaten, drunk, and swallowed for 60, 70, 80 years without once sending you a bill. It deserves a moment of your attention. If this video raised questions you hadn't thought to ask before, please share it with someone you love who takes supplements regularly. That conversation, just the willingness to look at the full list together, could be genuinely meaningful. Subscribe if you'd like to keep receiving this kind of careful, honest guidance built around the health realities of aging well. Every video on this channel is designed to give you real information, not alarm, not oversimplification, but the honest clinical conversation you deserve. And the video on melatonin and medication interactions is linked right here, because if supplement safety is on your mind, that one covers a different angle of the same important conversation. And the two together give you a much clearer picture of what your body is managing every night. Take care of yourself, and take care of that liver. It has been taking care of you for a very long time.